This is Health 54 right here on your digital first Pan-African news network, TOS Television. I am Rose Audu. Malawi has declared an outbreak of polio in the country's capital, Lilongwe. The detection of wild polio virus in a young child will be the first case in Africa in more than 5 years. In August 2020, Africa was declared polio-free. The World Health Organization said that the new case did not affect that status. A highly infectious and debilitating disease, polio is usually spread through contaminated water or food invading the nervous system and causing total paralysis within hours in some instances. And the National Tuberculosis, Borreliosis, Ulcer and Leprosy Control Program has said that 73% of Nigerians were ignorant of the high burden of tuberculosis in the country. The NTBLCP noted with concern that only 27% were enlightened about the infectious disease in a country of more than 206 million people. A leading private hospital in Kenya's capital, Nairobi, has carried out a penile implant procedure on a man suffering from erectile dysfunction. The Aga Khan University Hospital said this was the first time such an operation had been carried out in East and Central Africa. The Nigeria Center for Disease Control and CDC has confirmed 358 cases of Lassa fever recorded across 19 states, even as the world continues to battle with COVID-19. It also said that the fever caused 3 deaths in Britain, diagnosed from those who recently came back from West Africa. The Ugandan government will no longer conduct COVID-19 tests for passengers traveling into the country through the Entebbe International Airport, according to the country's Ministry of Health. The Director General of Health Services, Henry Mbesa, in a statement issued on Wednesday, said the decision was made following a decrease in COVID-19 infections globally. This is TOS Television. You are watching Health 54. More stories, including COVID-19 update when we return. Welcome back. This is Health 54 on TOS TV Network. A health expert, Dr. Toluwani Binutu, has urged Nigerians to eat less red meat and chicken, noting that they have saturated fats that could cause serious health complications. Binutu explained that saturated fats and trans fats are unhealthy fats, stressing that studies have indicated that they are contributing to the increase in the incidence of heart diseases, stroke and diabetes. The Ogun State government has said the prevention, low-cost diagnosis and treatment of sickle cell disease would contribute to a drastic reduction in under-5 mortality in the state. The Commissioner for Health, Tommy Koka, made this known while declaring open a 2-day training of health workers on comprehensive newborn screening program for sickle cell disorders organized by the Ministry of Health in Abeokuta. Koka said Nigeria has the highest number of cases of sickle cell disease in the world, describing the disease as one of the leading causes of infant death in the country. And 6 African countries have been chosen to establish their own mRNA vaccine production, the World Health Organization said on Friday, with the continent largely shut out of access to COVID jabs. Egypt, Kenya, Nigeria, Senegal, South Africa and Tunisia were selected as the first recipients of technology from the WHO's global mRNA vaccine hub, in a push to ensure Africa can make its own jabs to fight the COVID-19 and other diseases. Co-infection involving different SARS-CoV-2 variants have been rarely reported during the first wave of the coronavirus disease 2019 pandemic. Studies have suggested that co-infections could result in greater disease duration and severity. However, co-infections with variants of concern such as Delta or Omicron, have not previously been reported, particularly in immunosuppressed hosts. In the present study, researchers reported the first cases of Delta and Omicron co-infection in Sydney in 2 immunocompromised individuals at risk of severe COVID-19. And just before we go, Nigeria on Friday recorded 45 new COVID-19 infections, maintaining the trend of low infections recorded within the past few weeks. The new cases have raised Nigeria's infection toll to 254,182, while the fatality toll still stands at 3,141. The data also shows that the number of people still down with the illness is over 20,500, while a total of 230,530 people have been successfully treated and discharged in Nigeria since the disease outbreak 2 years ago. The Disease Center noted that FCT and Oyo State reported a backlog of 17 and 3 discharged cases respectively for February 16, 2022. And that is Health 54 right here on your digital first Pan-African News Network, TOS Television. For more updates, visit www.tostvnetwork.com. Do follow and like TOS TV Network on Facebook, Twitter, and Instagram. And remember to subscribe on YouTube. Do stay with us and enjoy more programs on TOS TV Network. Remember, health is wealth. So till I come your way again, do stay healthy. I am Rose Audu, and many thanks for watching.